Thanks for coming here today. And we're thrilled to have this panel. I think most of you were here for Gaylord Anderson's speech presentation by David Hemenway earlier today. And we appreciate having someone of his caliber here participating. I'll just do a quick introduction. We're going to have a moderator here today. Probably a lot of you are aware of John Roesler. He's been working at Minnesota Department of Health for more than 20 years. I met him 20-some years ago in injury and violence prevention. He is a supervisor injury epidemiologist. He is now the principal investigator for the Minnesota violence death registry. And he knows David Hemenway, as David's been the principal investigator nationally for this registry, which he spoke about earlier today. So I'll just quickly say, starting from your right, we have Richard Carlbom, who's been working as a political and community organizer in Minnesota in many levels of government. He was working as a campaign manager for Minnesota United for All Families, the official Vote No campaign that helped Minnesota become the first state in the nation to defeat a constitutional amendment banning same-sex marriage. And as you all know, we do have the freedom to marry for all committed couples in Minnesota. And Richard was communications director for the mayor of St. Paul, Chris Coleman. And he was the youngest mayor elected in Minnesota at age 23 for St. Joseph, Minnesota. And he's a graduate of St. John's University. And we've got Thomas Kottke, our medical director for population health at HealthPartners. He's been quite active in Minnesota. He's a clinical cardiologist, an epidemiologist, and also involved in research at HealthPartners Institute for Education and Research. So John will be moderating, and this session will go till about 2:20 today. So thank you.
Good. The way I thought I'd like to start off with this today is to have, you've gotten to know David a little bit from his presentation, but I've asked Richard and Tom to share a little bit about some of their work, their interest, and their involvement in gun violence prevention, so you know some of their perspective that they're coming from. I have a few questions that I do want to ask, and of course now I work a lot in terms of collecting the data, getting the numbers, finding out how many die from firearm injury, how many people are hospital treated from firearm injury. I work on developing the data systems to get those numbers. But the policy piece and the implication from that is something that is of interest to me, and I have questions that I want to ask them. So I have a few, and if you don't have any questions, I'm sure I will find many more questions to keep asking of this panel. But I do have a few to warm us up, and then we will open it up to the rest of you to ask questions. So starting furthest down here, if we could have Richard speak a little bit about his involvement with gun violence, his activity, et cetera.
Great. Well, thank you so much, and thank you to the University of Minnesota for hosting this panel and this conversation today. I come at this issue for two reasons. First and foremost, it's personal. About 12 years ago, my uncle, who is very close in our family, committed suicide with a gun. And it devastated my mother and my grandmother to an extent that they continue to be survivors and continue to grapple with that situation and the disease that he died from. And so I see it very personally in my own family. Like 80% of gun deaths in Minnesota are suicide, my family has experienced that as well. I also come at this because after we won the Freedom to Marry in June of 2013, I started having conversations with some of the great advocates in this state about ending gun violence and where they're at. And so if I take you back to 2013, of course, that is about 7 months after Sandy Hook happened. And in Minnesota, there was an effort at the legislature to pass meaningful gun violence prevention legislation. Unfortunately, lots of divisions took place, and the result was that we in Minnesota were not successful in passing new gun violence prevention policies. So it was at that point where I first got involved directly with gun violence prevention advocates in our state. And what I can tell you is there is an incredible number of people who have worked on this issue for decades, who have passion deeper than I ever imagined possible, trying to figure out how to solve and how to address this problem from a holistic standpoint. So today, I am the director of the state campaign for Everytown for Gun Safety. And our sister organization, Moms Demand Action, has a great number of grassroots organizers. But we also work in coalition with a lot of different groups. And I'm only going to mention the gun violence prevention focus groups, but be assured that there are countless numbers of faith organizations and faith leaders, business leaders. There's so many different people who really do care about preventing gun violence in Minnesota and trying to get us to turn this massive warship or this massive ship towards a conversation that's going to be much more fruitful. So some of the advocates we're working with here in Minnesota, beyond Everytown and Moms Demand Action, are Protect Minnesota, and Nancy Nord-Bentz is here. Nancy, want to give a wave? She's the executive director of Protect Minnesota. And we're also working with the Brady Campaign, and we're also working with Americans for Responsible Solutions, which is the organization founded by Gabby Giffords. Now, what is our goal? In just a few short minutes, we essentially want to try and take a holistic approach to this and recognize that the reason we have such a hard time in this state talking about gun violence prevention is because we are facing an environment that has been created over the last 30 years. The gun lobby and the NRA have invested millions of dollars across this country over the last 30 years to get us to the point we're at today, whereas we are restricted when it comes to actually collecting data and researching what issues of gun violence are out there and what possible policy proposals or positions can help reduce gun violence. We're in a position today where the NRA has tried its best and the gun lobby has tried its best to march across this country and continually, in state after state, pass less restrictive gun laws. But here's the thing. That's the environment we live in today. And as we all move forward into the future, we can't sit here and think of this situation as though we have an enemy in the gun lobby, and we as gun violence prevention advocates, or those of you who want to prevent gun violence, are the good people. What we have to do is we have to realize that we're all in this together, because those who consider themselves members of the NRA, 76% of them support universal background checks, right? Standardizing the background check process. And so for me and my family, I have an uncle who, if I want to talk to him about this issue, I have to use very careful language. I have to be able to talk to him about what are the meaningful ways in which we today prevent gun violence. Well, there are 7 different categories of prohibited purchasers. And if you go into a gun shop and you try to buy a gun and they do a background check on you and you are in one of those 7 categories, well, guess what? You're not going to get the gun. But you can go home and log on to armslist.com and within probably a day or so, meet somebody in a McDonald's parking lot somewhere in this state and buy the gun with cash. No background check required, even though you're part of those prohibited purchaser categories. And so we have to make sure that as we're talking to people, number one, we don't see people as our enemy, but instead we try to understand their perspective, understand where they're coming from, and try to have a conversation with them in which we start to find meaningful middle ground, common ground with somebody in order for them to start unwrapping and taking down their wall. The walls that people build up around this issue that prevent them from having a meaningful dialogue on what kind of policies we should be focused on really is our greatest barrier. And so our ability to change the conversation away from us versus them and instead focus on a public health perspective to understand where are the sources of this gun violence coming from, understanding in Minnesota it's 80% of the gun violence are people committing suicide by gun. And that there's not one solution to this. And so this is not a conversation that we expect to take place over the course of 3 or 4 years. But instead, it's like marriage equality. It's like the smoking ban in Minnesota. This is a conversation that we should anticipate that will go on for decades and may never end. This is a conversation where we need to be the ones who try to lower the intensity of the dialogue and instead try to encourage people to engage in meaningful conversation about how we move forward together.
Good.
I think, just to wrap it up, I think that there is significant progress. I said the gun lobby has been working for 3 decades to try and pass laws that make our communities less safe. But since Sandy Hook, we've had 6 states pass universal background checks in this country. We have wins behind us. We can have more wins, and God forbid, we do not need another Sandy Hook to get us more wins. We can do that together in a coalition with everybody working together.
Okay, thank you, Richard. Tom, would you like to speak a little bit about your involvement?
Sure, thank you. It's interesting. I think first time I was in this room was 50 years ago as a student, and this and the bowling alley are the only 2 things in this building that are the same. Everything else they've, totally disoriented. But I was born in the University of Minnesota Hospital too. I'm a latecomer to reducing gun violence, but my experience in public action is around tobacco control and eliminating smoking from public spaces. When I was in training here, we used to let patients smoke in bed while they were having a heart attack, and we decided that wasn't a good idea, even though our nurses said, well, you just treat the heart, we treat the whole patient, so yeah, we want to let them smoke. I never could figure out that. But from tobacco, and also I've made my career trying to figure out how to roll that stone uphill of getting doctors to talk to their patients about smoking. There's no question that they say this is the deadliest thing a patient can do for themselves, but I don't have time to talk about it. And so we've come up with some ways. A couple of points I would make for you, and then also we were here during the student strike when there was tear gas and National Guard troops on campus, and we were part of the strikers, and we went over and talked to Jack Flagler on the other campus, and he said, you guys come in and you talk about non-negotiable demands and this and that, and people get their heels dug in. And I would agree with Richard that I think everyone can agree that we want safe communities, but the problem is that I see a safe community as a gun-free community, and somebody else sees concealed carry or open carry as the way to have safety. And so starting the conversation around safety and then working to universal background checks, words make a difference, very important. Now, I don't think, about 30 years ago, I had a little drawing made. It showed a camel, and the neck and head was an internist with a stethoscope around his neck, and there was a line going back over the horizon, each person having one straw, wanting to put that straw on the internist's back. Just talk about A, B, C, D, E, or F, or G, or through triple Z during the visit. That's not going to work. But what's changed in the 40 years since I started here is that we now have large health systems like HealthPartners, and we can get to people in different ways. We don't have to go through the exam room. We have communications. We know how to communicate electronically. We know addresses. We can microsegment people. And so when you're talking about the healthcare system, think of working through the whole system. Don't just say, well, if we could just get the doctor to ask about guns. They should. There's no question. They should, but they don't, and I don't think we can expect them to. Finally, we need public policy. And don't expect that you can do it behind closed doors. People tried that with tobacco, but tobacco has so much more money than we did that it had to be public. And I think the same thing is true with gun safety, community safety. It has to be open, and it has to be public policy. Thanks.
Okay, good, thank you. One of my first questions comes out of my own data perspective as I've been looking at this. I really got involved with gun violence, I suppose, in the mid-'90s when we had the peak in gun violence. 1993 nationally in Minnesota was 1995, the year of Murderapolis, and they asked the question, what's the impact of violence on the healthcare system, and the answer was, we don't know. And Governor Arne Carlson convened the governor's task force on violence as a public health issue, and one of the things they started doing is they added the external cause codes to the hospital discharge data, which allowed us to begin counting things such as cases of hospital-treated firearm injuries. But as I looked at mortality numbers, I looked back to 1995, and we had at that time a record number of gun deaths. There were almost 400 gun deaths that year, of which over 100 were homicides and 270 were suicides. So we're getting this feel of what Richard's talking about. Since that time, that number was matched in 2011. It came up again. But the number of homicides had dropped from 104 to 59 for firearm. And the actual peak that we've had in gun deaths in Minnesota was in 2013 with 427, of which 76 were homicides, but 339 were suicides. So I'm really struck as I look at this data. We've had success and we've had some loss on this. We've made progress on the firearm homicide piece. We're losing ground on the firearm suicide. I'm wondering if each of you have a perspective on that and can tell us what have we done that has made a difference on this violence piece in terms of the homicide and assault, and why are we losing ground on the suicide? Yeah, David.
I was just finished 3 years on a National Academy of Sciences panel whose sole task was to try to understand why gun violence has gone let me go back. To understand why crime has gone down in the United States since the early 90s. And first thing we discovered, of course, was that crime has gone down throughout the developed world. I don't know if I probably mentioned this, but nobody knows why. And so we had 24 theories that people came in and propounded to us, and we looked at all the data. And after 3 years of study, I think it's fair to say that our conclusion was we still have no idea why. But what I've discovered, which I hadn't known before, is that crime has actually gone down since continuously, basically since the early 70s, and that there was the blip in the early 90s was only a small blip that of young male, typically inner city minority, and everybody else in terms of homicide, in terms of crime, the national crime victims, was going down. So the reason gun crime is going down is because crime was going down. That's the reason. It's nothing to do with guns directly. It's just if there's fewer robberies, if there's fewer assaults, there will be typically fewer gun robberies and gun assaults. The suicide piece, suicide has been pretty stable throughout the United States for many years. It's one of the few things which was pretty level, and then recently it's gone up a little. And again, I don't think we know, in part because, as I mentioned, injury is one of the areas in public health which is about the least studied. And so there's a lot of things which go up, and drownings has gone down in the United States for the last 40 years, and the answer, I don't think we know why. And fire deaths have gone down, and we think it's partly because of smoke detectors, but we really don't know. Mm-hmm. And there hasn't, it's one of the things I learned from criminologists is that there's very few criminologists even who studied long-run time trends. Their big focus, which I think is a wrong focus, is on who's going to become a criminal rather than why do we have trends in crime and even waves in crime. So there's so many things in the gun area that we really need to learn, and that's why I do gun research.
Okay. Richard or Tom, any other? Okay, good. Let's see. So one of the things then that comes to mind out of that? Oh, okay. So, David, you had put a nice slide up there of all these things that you wanted to learn or that we could learn about with additional research on firearm injury. And I'm just wondering from each of you, if there was the next one thing that you could learn that is going to drive firearm policy at the state or at the local or national level, what's the one thing? Why do you want to know that? How would you use that to advance our efforts towards gun violence prevention? We can start maybe with Richard there, huh?
So in a research angle, the one thing I feel like I want to be able to understand more is the link, is whether or not, so the 18 states that have background checks plus the Washington, D.C., you see fewer number of suicides, a lot of different gun crimes, but fewer number of suicides. In Minnesota, where 80% of our gun deaths are from suicide, I think in order for us to speak articulately to all members of the legislature, we have to understand the impact that passing background checks in Minnesota, closing the 3 loopholes, can have on that issue, or if there is one. Because if there isn't one, then that's something that we, I think, need to be honest and transparent about. I suspect that there is, but I don't think that we have the information in front of us right now, and that's one thing I'd like to know.
I guess I'd like to know the message that will mobilize the folks who want the background checks without stimulating or panicking the folks who think that their Second Amendment rights are being taken away. Another bit of knowledge I'd like to know is, does our message say, and we used to, somebody remembered institutionally before, I've been at HealthPartners for 12 years and 17 years at Mayo before that, and about 10 years here at the U. When we give a message to say, lock up your gun, I mean, we used to apparently pass out gun locks, trigger locks. And I have a trigger lock, I have a 22 up at the cabin that I haven't shot for, I don't know, 20 years, 30 years. And there's a trigger lock on it, and the keys are somewhere, probably lost. But that's fine. But I remember there's a grand lady of was at Hopkins, Sue Fletcher, an internist, and did a study of telling moms not to put caustic chemicals under the sink because your kids were going to get poisoned. And very clearly, you know, and so they did this really nice program, and then they went out and checked, randomized trial, no change. I mean, where else would you put your caustic chemicals? I mean, you know, like, and it's like, hey, my kid's not depressed. And I mean, how many people, you know, somebody who's committed suicide that you know, people say, we didn't have any idea, right? The first sign of depression is suicide with the household gun. And 75% of kids who commit suicide with their parents' firearm, and it's usually a pistol. And so I'd like to know, you know, is our message, is this an effective message? And if not, what is the effective message that we can do to make it so that only the gun owner can fire the weapon, either because it's a smart gun or because they're the only one that can get at it because they have a chip in their ring or a fingerprint, you know, a thumbprint gun locker or something like that. But I'd like to know, what is the effective message that we can put out, because we're working at HealthPartners to develop messaging around this topic.
Okay. David?
So I think there's just so many things. I hate to pick one, but one of the things that, so when I did the research for this book on success stories in public health, there's so many lessons just from doing that. One was that things took so much longer than you hoped. And one was that data really mattered and research really mattered, but one was that there are always people violently against whatever you're trying to do. And it could be, I mean, how could people be against this? And even looking back in the history of public health, which began with the sanitation movement, it seems like people were strongly against getting the poop out of cities. It's like, come on, how can you be against that? What are you thinking about? And so I would love to be, if I had time, I wrote this book in this book, it was about here are 36 heroes who have made a difference. I'd like to really understand sort of the anti-heroes. Who are these people who are against all these things, and how to make them so that they were less likely to be, and so instead of taking 40 years, it could take 20 years.
Yeah, that kind of reminds me, I remember doing a presentation once on the number of gun deaths and the gun injuries in Minnesota, and I presented it to a group that included NRA members, and one of the NRA members came up to me and said, "Your data is not helpful at all." And I said, I'm kind of, wow, this isn't what I do. And I go, why is that? He says, it doesn't help because this is not about people who are being injured. It's about the right to keep and bear arms. That's what it's about. I go, oh, okay, that's a helpful perspective. I understand. But now, and picking up with that, David, one of the things that I've been struck with when we talk about this a little bit, and for the rest of the panel members, I think about the current election cycle with candidates regularly making statements that are either false or based on falsehoods and seem to be based more upon emotion and passion. And they seem to get a lot of public airing, and they continue to do well in the polls, etc. What is our message in gun violence? How do we address this issue? Because, David, you say data matters, but yet in many ways we see that data doesn't matter. We have a statement in public health surveillance. We say, the good news is data can really make a difference, and the bad news is it rarely does. So where do we go in kind of this new current environment where it seems that data and information and reason has been devalued?
So one of the things that we're trying to do research on, again, is how, and someone mentioned this, is about how to talk to people in a way that can affect the way they understand the world and what they're willing to accept as the way the world should be. So we're involved a lot trying to reduce suicide and trying to figure out ways, what are the right ways to get gun owners who are so many are so incredibly reasonable and very smart, to get them to understand, this is a problem, and if you present it often as a problem, they are the ones who figure out the concrete, practical ways to help solve the problem, rather than saying, you're bad, you want to do something, but we really don't understand how to get them into this situation so that they are problem solving with us rather than fighting against us. And that actually involves research as well as just, we should try this.
Yeah, I would agree that, and we have 1.5 million members at HealthPartners, and we have 1.5 million patients. That's a lot of people. And if we can get to them, and first of all, I would say avoid trading punches with the people who say, we're going to get rid of the Second Amendment. Just stay calm, keep smiling, just like you're figure skating, and stay reasonable. But yeah, the majority of gun owners are very reasonable and don't want their weapons used in some kid's suicide. And so I think where we would go with it as a health plan is to get some gun owners in, and exactly that. What are the messages? How can we get you to lock up your guns, disable your guns when you're not using them, whatever, so that you don't have to have a lifetime of remorse that some kid stole your gun or your kids were playing. I mean, we found guns up top shelf, here or there, and I haven't had personal family members who have committed suicide, but I have several people I can name who weren't known to be depressed, and they were through readily available firearms. But what is the messaging? And again, like Richard said, don't set it up as enemy, and don't trade punches, but quietly seek those people who are willing to make the change because they don't want to be part of the problem. And I think that's probably the majority of gun owners who would be willing to lock up their weapons so that they weren't contributing to some kid's suicide that was just a flash of despair because the love of their life of 20 minutes, turned them off.
Yeah, so I think language matters, as Dr. Kottke was saying, and so two things about this. One is, when it came to marriage equality in this country, it was a 30-year fight, and it wasn't until 2000, after the loss in Maine in 2009, that all these organizations took a collective step back and said, we've lost 30 times, maybe we're not doing something right. Maybe we're not saying the right words. And they undertook this massive new research project, and they came up with this idea, if you can actually, instead of arguing with people and saying if you don't support marriage equality then you're a bigot or you're for discrimination, immediately putting people on the defensive, maybe it's time we start having a conversation with them and asking them about why they believe in marriage and why it's so important to them, understanding the language they use, and then making sure that we start to draw connections to the reasons why same-sex couples want to get married for very, very similar, same reasons. I think the gun violence prevention groups have begun this now. And I would say they probably started it a couple years ago, and they are trying to look at this from a language and message perspective. How do you actually use language that connects with people? So nobody in the gun violence prevention movement now will use the phrase gun control. That's 86th, right? Now we use gun safety and gun violence prevention because we know if you have a conversation with people about gun safety, every person most people who own a gun in this state understand the importance of gun safety, and having and owning that gun, there comes a level of responsibility and safety education that should go with it. That is a commonly held belief that we as advocates need to learn how to use and plug into. The other thing I would say is that through some research and some deep research, both through focus groups and just general polling, we have found that phrases like support for the Second Amendment goes hand in hand with keeping guns out of the hands of dangerous people, felons, and those suffering from severe mental illness. That kind of conversation, that kind of short phrase is actually a phrase that turns this around. We go from 35% support to 65% support when you start using language like that. So there's ways for us to plug in to where people are at right now, and I think we're every year gaining more and more understanding about what kind of language will work. And just one quick anecdote. Yesterday was June 2nd, which is the National Wear Orange Gun Violence Prevention Day. Thank you for wearing orange, Dr. Kottke. And you have your pen. Yes, and John. So I post something on my Facebook page as I'm doing work in this area. And of course, a friend of mine from high school who is the third string quarterback immediately posts, "You dumbass liberals, you're always trying to take the guns away." And it just ignites this firestorm on my Facebook of advocates who want to prevent gun violence punching back at him and him defending himself and punching back. And so finally today, I just put a little blurb on there and I said, look, if we can agree that felons, domestic abusers, and rapists should not get access to firearms and they should be prohibited from obtaining a gun, why shouldn't we have those same kind of rules when it comes to gun shows and armslist.com and person-to-person transfers? And for the first time in I don't know how long, every time I post something, he has some kind of comment, antagonistic comment about liberals. And for the first time in I don't know how long, he actually said, well, when you say it like that, I can't disagree with you, right? And so it's just really, you can look, this is just an anecdote of one person, but you can look and you can see all these people who's engaging him and sending him NIH data and links, and that wasn't ever gonna change his mind. But if we try to follow our research and understand how maybe they're thinking about it, we can create one point of connection. Now, I did not change his mind. He's not going to be our biggest advocate. But I think we can start people like that on a journey to saying, wait, maybe there is something here that I can agree with.
Okay. We have some questions now from the audience. One question here. We've heard today a few good examples of ways to work with gun retailers, store owners. I'm from local public health and looking for examples and strategies I can bring back. Can you point me to both strategies and counties working on this? So this is in relationship to gun retailers and store owners.
So this initiative started in New Hampshire, where there was a coalition of gun advocates and gun owners and public health people working together, from data that came from public health, which showed that here's 3 suicides that occurred at this gun shop, and then it was a problem. What can we do about this? And there was all these wonderful things, suggestions made, and from that now there's been 20 sites which are doing this type of thing, and the place to find out about this is if you look at our website, Harvard Injury Control Research Center, Harvard Injury Control Research Center, HICRC, and look under the Means Matter area, you can see some of these things. We're going to have, I think, 2 commentaries in coming out pretty soon about examples of where these things have been happening. And the best person to talk to is the person in my shop named Kathy Barber, Barber.
Yeah, that's valuable, because when we did Smoke-Free Hospitals, we put together a book called Clean Air Healthcare. So it was, first of all, it was positive. And we had, up to that time, and I just sort of had this aha moment down under the Phillips Wangenstein, and when they had the art department down there, there was a brochure for a anti-smoking conference, and they had it had tobacco smoke all over and everything else. And I mean, you didn't even want to pick it up. I mean, and basically the tobacco control was being tarred with the tobacco brush. And so we made it very positive, and I had my 5-year-old daughter do all the artwork and everything else. But in it, we had named contact people with phone numbers. This was long before the internet, but having people, the question is, can I do this? And B, can I live to tell about it if I do it? And so I think that's very important that to work with the gun owners, because they too, I think most of them don't want to know that they've sold a weapon that's been used in a suicide the next day. And the evidence is very clear that when a gun goes into the household, suicide that first month is a very high suicide rate period of time.
I couldn't agree more. I mean, one thing that as Nancy and I see Marilys Grow, as we think about, and Beth Commerce, who are advocates working on this every day, as I think of one area in the state where we don't have a strong voice, where we're missing a voice, is from gun shop owners. And there are so many federally licensed firearm dealers in this state. The average Minnesotan lives closer to, within 10 minutes of a federally licensed firearm dealers. There's more of them than McDonald's in this state. Talk about public health. And so there's an opportunity here for us to begin a meaningful dialogue, and if there are people in the public health community who want to take that on and start to create a relationship with those folks. Number one, they're at somewhat of a disadvantage. They always have to follow that background check process, right? But then their competitors who are at gun shows or selling on arms list don't have to follow that background check process. So they're already doing it right, and they're already making sure that guns in this country go into the hands of law-abiding citizens. And so we should thank them and develop a relationship with them and get them to be somewhat advocates, or at least engage in a conversation with us.
Okay, good. Continuing on in this same line, a little bit of what can happen locally. A couple questions here. First one, as we move beyond primary and secondary modes of preventing guns being disseminated illegally to high-risk actors, what can public institutions like schools or theaters or health plans do to remove, prevent, or reduce injury? And then the second related question, are there examples of programs working to reduce guns in neighborhoods? I'm originally from Metro Detroit area where they buy guns back from people. Thoughts or comments about what happens?
Well, the first question sounds like a thesis question. So to the first question, people have ridiculed this National Gun Violence Prevention Awareness Day yesterday. I've been seeing people who just, maybe are a bit on the anti-side saying, so wearing orange really is going to change? Yes, it does. You know what? For a long time, this has been an issue that so many people have been reticent to engage in a conversation about because they just expect that they're going to be shouted at. And if those of us who want to talk about it and have meaningful, respectful conversations about it help increase that awareness by wearing the color orange, then that's helpful. And so when I think about what schools can do beyond just keeping the hands out of dangerous people, I think that helping us understand how the next generation is going to think and engage on this topic. I mean, one of the great things about the University of Minnesota is that you pull people from urban areas and rural areas. And we know that in rural parts of Minnesota and greater Minnesota, not that this is lesser Minnesota, but in greater Minnesota, we know that, owning a gun is part of your heritage. It's how you grow up. Learning how to shoot when you're 11, 12, and 13 is the way of life. And so trying to understand on a campus like this how you create a dialogue among students about awareness of gun violence without somehow making those who have it as part of their heritage feel like they're ostracized or they're part of the community. And they have a role in helping us understand how to connect with folks where they live about this issue itself.
Thinking of being ridiculed, we wrote, Andy Dean and I and Jim Schultz, and there may have been another author on it, published the Minnesota Plan for Smoking or Health in Minnesota Medicine in 1985, and the tobacco industry laughed at us. They said, you got to be kidding, you think you're going to get rid of smoke. I mean, the last time I went to Finland, the whole trip, I wasn't exposed to any tobacco smoke at all, So it does take 20 or 30 years. Smoke-free hospitals was 20 years, but it can be done, and I think public support, just whatever you can do, wearing orange. When I saw the article in the Strib and Matt Stark was mentioned and the mayor, I immediately banged off an email saying, thank you very much, because these guys probably get 10 emails the other way or 20 emails or 100, but for those people who are out front on this, thank them, because they need that.
In terms of what each group can do, because when I go talk to the faith community, they want to know, okay, now what can we do? And I just went and talked to this retirement home, and they want to know, what can we do? And I throw out these suggestions, but that's not, what do I know exactly if it's going to matter or not? But one thing I do think needs to be done is that you really want a place where all the innovative things which are being done in all the various areas are easily collected. And in this day and age, it should be, you shouldn't be asking one individual, it should be a place online where, all right, here's health plans, here are the kind of things that health plans have done and what they've been able to do. There's just a really good article written by a liberal think tank in Washington, D.C., which said, all right, here are 25 things that a governor could do that would not require anything for the legislature that a governor could do about reducing gun violence. And I think it came out of because Obama tried to do, here are 40 things that he tried to do, which had nothing to do with having to have something passed. But I think that should be, one of the big problems in this area, again, is that there hasn't been very much money, though there is more now because Bloomberg has put in money. But what you'd want to see if there's a real movement and people and foundations see in the tobacco area, foundations were willing to give in some money, and you can get some money from certain government agencies, which hasn't been the case. And you want brave foundations to step up, and here's one of the many things that could be done, is to try to combine together the wisdom of all the United States, what we've been doing in all the various areas. Because I could tell you a couple of things of exciting things that have been happening in Boston, but it's only one little thing, and I have no idea what's been happening in New Orleans or happening in all these other places.
I couldn't agree with you more. One of the great things about this state is that there are county attorneys, sheriffs, city police chiefs, mayors, council members, county commissioners throughout this state who do something, faith leaders, each and every day that impacts gun violence. A faith leader who gives a sermon in Baudette, Minnesota matters. They're preventing gun. When they talk about suicide openly in their community and the tragic deaths they experience, they actually are making a big difference. And one of the things I think we need in Minnesota, and the School of Public Health could do this, is a way for us to systematically recognize those meaningful steps toward preventing gun violence. Because right now, when we talk about preventing gun violence, I automatically have to focus on a political strategy that's ultimately going to pass background checks in Minnesota. But wouldn't it be nice if preventing gun violence became such a common conversation in this state, where we are able to recognize a county attorney in St. Louis County while recognizing a sheriff in Becker County for maybe some small but meaningful step? They went in, had a conversation with a group of clergy and held a twice annual meeting about how clergy should address the issue of suicide in that county. Can you imagine if they were recognized and awarded publicly for that meaningful step? They're not doing anything to oppose an agenda of the NRA, but they're just simply trying to figure out a way of getting this community to talk about the issue in a different way, and to think about the issue in a different way, and to understand that each and every one of us can find some way to participate and impact this issue.
I think that's a fantastic idea, to have a series of awards for people who sort of, let's call them the civilians. They're not the activists. But they're the people who are in different walks of life who have taken a meaningful action. And when I lived in Rochester, we did a program called CardioVision 2020, and we gave awards to people who did things, either restaurant owners or other sort of people in different walks of life who did things to promote cardiovascular health. And it was very meaningful to them, and people really appreciate it when you say thank you, and it's very meaningful. And the School of Public Health could do this. They're not a government agency, and they could just simply identify people in some way or other, and just do an award, press release, generate their own news around this, that get the idea that people are, and this would spread the idea about how you do this in a relatively quiet way to influence communities so they're safer with firearms.
I'll jump on the bandwagon. So just two things. One, in the last 10, 15 years, we've met a couple of times with the Hollywood community, trying to get them to figure out ways what they could do to reduce gun violence. And one of the meetings we had with the sort of the movers and shakers there, we met for the whole day, and at the end they decided that the thing which they were going to do is give awards. I thought, oh my God, more Hollywood awards to whoever could do something. And Hollywood actually does, occasionally do good things and bad things. So I like that. When we were a youth violence prevention center in Boston, we had community partners who we met with, and we asked them to suggest people who should receive awards. And we had this incredible evening event at Harvard where we got Miss America to come, and she crowned these hairdressers and people living in the community who had really done lots of good things to try to reduce violence and gun violence. And I thought that was incredibly moving to them, and really made such a difference. And it's so easy to do, and it doesn't require a whole lot of things. And again, one of the things in public health is that everybody can do something. When I go to the faith community, one of the things I would like to see them do is to try to make it so that not only do we want it to be illegal to sell to someone without a background check, but I think we want it to be immoral to sell to somebody without a background check. I mean, what kind of, when I was, growing up, there were so many Westerns on TV, and the most evil person was the one who sold firearms to the Indians. And that was like the lowest of the possible low. And I think there are people in the United States right now who sell guns to strangers without a background check. It's legal, and they think it's perfectly fine. And I think if you could get the whole large numbers of the faith community to say, no, this is not, this, all you're doing is increasing the likelihood that someone's going to die. And this is not something for you to make a few dollars on. That you should feel good about it, and no moral member of our community would ever do that. And I think if the faith community stood up on that one issue, that would make as much difference as if you passed a law. But what I'm trying to say is that, you know, it's not sort of for us to say, oh, here's what this group should do, here's what that. It's that, you know, people, if smart people got together and you said, all right, you know, I run a health or, you know, an HMO. What can we do? Let's all get together and think about what we can do. We can find out what other people are doing. And suddenly, if this was a real goal, you would get the most incredibly good ideas of what to do.
Okay, we are almost out of time, but here's the scoop. I'll set a stage, and you get a short answer on this last piece. One of the things, when you talk about gun violence, and gun deaths in particular, you end up talking about suicide. But we know that when you talk about suicide, even in epi-neutral terms, research has shown that that introduces contagion and actually increases suicide. So it's very important whenever we talk about suicide in particular, that we have a message of hope. If, when you walked out of here, the Star Tribune reporter cornered you and said, you know, talk to me about gun violence, what's a message of hope that you would incorporate into your interview? Just real quickly, what's your message of hope that you would incorporate into a discussion of gun violence? Just a few phrases, a sentence or two, not more than that. Go ahead.
Support for the Second Amendment goes hand in hand with keeping guns out of the hands of dangerous people, mentally ill, and felons. And our hope is that Minnesota can close 3 loopholes to continue to do just that.
Good, thank you.
I would say that they laughed at us when we said that we could eliminate smoke in public places. We did it. Yes, we can do this.
And I agree with that. And if you to focus on suicide, I would say that the great success stories in suicide prevention of the 20th century have all been means matter success stories, getting the popular lethal means away from people who are at high risk. And I tell them those stories.
Very good. Thank you very much. Let's give a hand to our panelists.
Thank you to our panelists today, and thank you all for coming. These are the end of the sessions, and we have a reception up on the 4th floor at the campus club. So you can head out, and there's a set of elevators out here to the left.
Yeah, great. Yeah, I'll put.
Thank you so much.
Yeah.
Always a message.